So the first one, demographic cycles, otherwise called as the demographic transition. So it is nothing but the stages through which the population passes and how it is developed. So here we are showing the changes of birth rate and death rate. So this is the most common questions we are asking. The next one, stages of demographic cycle. The first stage is high stationary. So that means the birth rate is very high, death rate is high, and if you see the population growth very slow. And what is the reason means poor sanitation, famine and epidemics, and lack of medical care. And if you see the example, primitive or tribal societies. And stage 2, yearly expanding. So the birth rate is high, death rate is rapidly declining, and population growth is rapid increase. And what is the reason? Improved healthcare, sanitation, nutrition. Example, many developing countries. Stage 3, late expanding. So here the birth rate declining, death rate low, population growth moderate. Reason, family planning, education, urbanization. And what is the example? India. So the present stage. And if you see the stage 4, low stationary, and birth rate is low, death rate is low, and population growth is stable. And what is the reason? High standards of living and effective health services. Example, developing countries like UK and USA. When stage 5, declining, so sometimes it may be included. So birth rate is very low and death rate is low or rising, and population growth is declining, and reason is aging population. And example, Japan, German. And what is the importance of studying the demographic cycle? The first one, it helps in health planning, and second one, guides population policies, and third one, it is very useful resource allocation and important in community health nursing. Next topic is world population trend. So this refers to long-term changes in the size, growth, distribution and structure of the global population. And next, move on to the major world population trend. The first one is rapid population growth. If you see world population, it has been increased rapidly in last 200 years. What is the reason? So decline in the death rate. So because of more facilities, that improvement in medical care and good sanitation and good nutrition. So the growth is uneven across the region. And next one, uneven distribution of population. So the majority of world population, they are living in Asia and Africa. And sparse populations are in the desert, polar region and dense forest. And declining for fertility rate, the third one. So how means many developed countries shows low birth rate and then below replacement fertility. And if you see the developing countries still have and moderate to the high fertility rate. And fourth one, aging population, increasing life expectancy worldwide, and then higher proportions of elderly population, and then common in developed countries. So that leads to increased healthcare needs and social security burdens will be there. And if you take the urbanization, there is a shift of population from rural area to urban area for their various jobs. So the agriculture, they are banned and they are moving to the some of the IT companies and they are working. And what is the causes? Industrialization. And seventh one, population stabilization in developed countries. So if you see birth, death rates are both are very low and population growth is stable or declining. Okay, next, health implications of world population trends. So you have increased demand for healthcare services and then MCH care. And what are the challenges in nutrition, environmental health, employment and education? So these are all the challenges we have to face and we have to rectify. The next one, vital statistics. So what do you mean that? Is a systemic collection, compilation, analysis and interpretation of data. So this is related to the vital events in the human life. So many members, if they're asking question, they will write the vital signs that is wrong in the community. It mentions what are they. The first one is the birth and the second one the death, fetal death that we are calling as a stillbirth, marriage, divorce, morbidity. The next one, what are the sources of vital statistics? The first one is a civil registration system. So this is continuous and compulsory recording of the birth and death and most important sources, CRS. And next one is the census. So this conducted every 10 years, and they provide the population size, age, sex, literacy, population, occupation. And third one is a sample registration system. So here they will provide reliable birth rate and death rate, and this is used in India. And the fourth one, hospital and health record, birth and death record, disease statistics. So every day night at 12 o'clock, so they have to give the report about the birth death records. And next one, disease notifications, reporting of notifiable disease. And sixth one is the survey, national family health survey, and the national sample survey. Okay, what is the main use of taking vital statistics? The first one, we are measuring the health status of the population, and second one, planning and evaluation of health services, and third one, we are monitoring population growth, and fourth one, studying trends in morbidity and mortality, and fifth one, policy formulation. So this is about the uses of vital statistics. Next, move on to the important vital rate, crude birth rate. So that is CBR, number of live birth in a year by mid-year population in 2000. And second one, crude death rate. So number of death in a year by mid-year population in 2000. Infant mortality rate, the death of infants that is less than 1 year by how many live birth in that particular year in 2000. Maternal mortality ratio, MMR. So this MMR is maternal death by live birth into 1 lakh. So this is about the important vital statistics. Importance in nursing, helps nurses in community assessment and planning maternal and child health services. Then we are evaluating the health programs, and then research, it will be useful, and for teaching program it will be very useful. Next one, sex ratio and child sex ratio. So these are important demographic indicators we are using in vital statistics and community health nursing. So sex ratio, what is the definition? So this is the number of females per 1000 males in your population. What is the formula? The number of females by number of males into 1000. Okay, continuation of this importance. Indicates the status of women in society, and it reflects gender equality, and this helps in planning maternal and women welfare program. The next one, child sex ratio. What is the definition? Child sex ratio is the number of girls per 1000 boys in age group 0 to 6 years. So formula is the number of girls by number of boys into 1000. What is the important sensitive indicators of gender bias and female feticide and discriminations against the girl child, and important for planning child welfare services. And difference between the sex ratio and child sex ratio. So aspect, population covered and sex ratio, total population, and indicators of overall gender balance and affected by mortality and migration. Public health significance, so declining ratio, it indicates gender discriminations and poor access to the health care, mostly for the females. And some of the government programs like Beti Becha, Beti Beda and PCPNDT Act address this issues. So already we discussed previous topic, just have a look on that. The next one, historical trends, census data, overall sex ratio, female per 1000 males India. So previously if you see 1901 972 and 2011 943. Okay, what is the trend? What is the change? From the earlier 20th century to 2001, there was a declining in the trend in the sex ratio. Fewer females related to the compared to the males, and between 1 and 2011 it has been improved moderately and gradually, and overall long-term trends shows a gradual improvement recently, but the ratio is still not fully balanced. Child sex ratio, in the year of 1981 962, 1991 945, 2001 927 and 2011 919. So what is the trend? Child sex ratio has declined sharply from 81 to 2011, is showing that fewer girls per 1000 boys. So this decline was partly linked to the misuse of prenatal sex determination and sex selective abortions. Recent data survey. So according to National Family Health Survey, so the overall sex ratio 1020 females per 1000 males, it has been improved and crossed the parity. And if you see the sex ratio at birth, 9 to 9 girls per 1000 boys, showing improvement from the earlier. And what is the trend? The recent survey suggests the continuing improvement in overall sex ratio, and there is a gradual progress in the sex ratio at birth. True, the disparities remains. Regional variation. Southern and north eastern states Kerala generally report more balanced or even female favoring ratio, and some northern urban areas like Haryana, Delhi, Gujarat historically lag behind, and they show worse ratio, especially among the children. This is about the religious variation among southern northeastern state and some of the northern urban areas. And next one, what are the causes? The causes of declining imbalanced sex ratio. The first one, preference for male child. So if you see culturally, they believe that sons they carry the family name and perform the last rites, and then provide the financial support, and daughters seen as a burden, that is economic burden. And if you see the second causes, the female feticide and infanticide. So misuse of prenatal diagnostic techniques. So they will diagnose, that is ultrasound, and they will identify the female baby and they will be abort. And sex selective abortion despite PCP and DT Act. So according to that act, the doctor should not tell the sex, what sex girls, and they should not abort. That is the very important act. And third one, neglect of girl child, poor nutrition, less access to healthcare, higher mortality among the girls in early childhood. And fourth one, early marriage and high fertility. So repeated pregnancies until a male child is born, and there is increased maternal and female child mortality. So mortality means death rate. So because of too many pregnancy, so the maternal and female child are dying now. And fifth one, low status of women, so limited education and empowerment, and there is a lack of decision making power. And third one, then gender discrimination is there. And sixth one, migrations, so male dominated migrations, so they are moving to the urban and industrial area. If the male is working in the urban area, the family itself they are moving, and affects the sex ratio in certain religions. So next one, social implications of adverse sex ratio. The first one is the gender imbalance. So there is a shortage of women in reproductive age group, and there is a disturbed population structure. And second social problem, there is increase in trafficking of women, and they're forcing for the marriage and polyandry in some religion. And then violence against the women, so increased domestic violence, exploitation, and then sexual crimes. And fourth one, decline in family and social stability, so they'll have difficulty in marriage prospects, and then breakdown of social harmony. Then health consequences, there is increased reproductive burden on women because of boy preference, and mental issues among the unmarried men. And the sixth one, long-term demographic impact, so this affects the population growth, maternal and child health indicator, and then future workforce balance. And last one, role of government and society, so PCP and DT Act and Beti Bacha Beti Padhao, and this is promoting the female education, women empowerment, gender equality awareness.